But first, why would a fertility clinic risk octuplets in a young woman? If anybody can answer that question, it's Dr. Sherman Silber of St. Luke's Hospital. You're going to hear what he thinks about this next on Extra Edition.
This is Extra Edition from News 4 and the Post-Dispatch.
Good morning to you. Welcome into Extra Edition. I'm Mark Cox. The story of Nadia Suleman is amazing no matter how you look at it. The 33-year-old delivered octuplets after a fertility clinic transferred a huge number of embryos into her womb. We learned then that she already has 6 other children, no job, and no husband. Many people are asking, why in the world would she want to do that? And did the doctor in this case act properly? Those are good questions. You'd be hard-pressed probably to find a better person to answer the questions about fertility than Dr. Sherman Silber, director of the Infertility Center at St. Luke's Hospital. And we appreciate you being here. Dr. Silber is an internationally known pioneer in treating infertility. Good morning to you.
Good morning. It's a pleasure to be here with you.
Well, I appreciate you being here. Obviously, you've been watching this situation from afar. Let me ask your reaction when you first found out about it.
Well, it was obvious that this is really poor medical care. There are going to be a lot of emotional comments about social issues. Should she have 14 children? But I'll stay out of that. That's something that is everybody's talking about it. But the real issue is the danger to those children in transferring so many embryos. It was clearly malpractice. And I am afraid that many infertile couples who desperately want to have children will read about this and see it and be afraid of fertility treatment. But that's not what good fertility treatment does.
No, then talk to us about what good fertility treatment is. If a woman comes in and wants in vitro, is it not normal to put in a larger number of embryos than you expect she will give birth to, correct?
That's absolutely right. And if it's a poor program that has a poor lab, that has a low pregnancy rate, and that program in Los Angeles did, then they will often put in a lot of embryos because that'll increase their pregnancy rate, even though it risks a dangerous multiple pregnancy. I mean, we don't want to even have more than twins. We want safe pregnancies. And in fact, there are a lot of fertility treatments that can produce these very dangerous pregnancies. I guarantee you, no matter what the press says about how nice it is, a lot of those children are going to have severe developmental problems. They're lucky they're alive, but they're going to have severe problems. It can't be otherwise when this happens. It's a very expensive, probably $2 or $3 million delivery. That's what it costs the healthcare company, I'm sure. And in terms of help for those kids later on in life, it could be a $10 million expense. And it didn't have to happen because if it were a good program, they could put in just 1 or at most 2 embryos at a time, have a favorable pregnancy rate, and freeze all the extra embryos for later. I'm not saying she shouldn't have had 8 kids, but let's have them 1 at a time so it's safe.
You know, that's a very good point. Let me ask you this about the doctor in L.A. who did this. Was he playing the odds? I mean, was he gambling that it was safe for him to put in the larger number of embryos to try to increase his chances of her having, let's say, 2 or 3 children, so that he could brag that his practice had a higher success rate?
That's exactly right. He was gambling with the odds, figuring that, well, at least I'll get her pregnant. We don't have a great program, he's saying, but at least we'll get her pregnant. It probably won't be any kind of dangerous multiple pregnancy, but of course, sometimes it backfires on you. One of the reasons for this is people are saying, well, shouldn't we have more regulation in the infertility industry? Well, we have a lot of regulation. It's just bad regulation. We are monitored by CAP, by SART, by FDA, by CLIA. I mean, we have a lot of monitoring. It's very poor. And the laws require this clinic-specific reporting of pregnancy rates. But they don't enforce that it shouldn't be used for marketing purposes.
Right.
So there's a motivation on the part of these clinics to transfer more embryos so they can boast a higher pregnancy rate and use that for marketing purposes.
I'm not trying to trivialize this at all by saying this, but isn't this the equivalent of hitting the lottery? I mean, what are the odds, and this doctor had to know that, what are the odds that he was going to implant that many embryos and they would all take?
Oh, well, it's pretty good odds.
Oh, really?
Oh, yeah, yeah. I mean, this guy, most IVF programs that are good will do more than 100 cycles a year.
Okay.
Really good programs will do maybe 500 cycles a year. He did 20 cycles in that year, and he had 2 pregnancies, which is just really, really disastrous. And of those 2 pregnancies, one of them was the octuplets. So, I mean, he had pretty good odds of having a dangerous multiple pregnancy.
You know, recently there's been a lot of focus on regulation on Wall Street and a lack thereof.
Right.
You've already mentioned that you have a lot of agencies who oversee this process, but obviously there's still not enough. I mean, does there need to be another step put into the process here?
Well, yeah, first place, there have to be some teeth put into it. And that law that was passed in 1992 it was a Wyden bill, needs to be revised. It's so stupid, and it needs to be enforced in a better way. It says that we have to have clinic-specific reporting of pregnancy rates, but it doesn't say that this must not be used for marketing purposes. There is no restriction on the number of embryos transferred per woman's age. We have our own guidelines. I mean, our professional guidelines say no more than 2 embryos transferred in a woman under 37, but there is no teeth in those guidelines because those are voluntary guidelines.
So if I'm a woman like Nadia Suleman, I can doctor shop till I find the person basically that's going to do what I want, is how the industry is right now, right?
That's exactly right. We have our standards, but we don't have teeth in it, and the regulators who are, we're audited at least 4 times a year by different regulators, but they don't have teeth, and they can't really do the right thing.
All right. Well, Dr. Silber, we certainly appreciate you being with us and kind of putting this all in perspective here for us this morning.
Oh, thank you very much.
Thank you. Our pleasure. Thank you.